Hi, my name is Diane Rohlman, and I am a professor at the University of Iowa in the Department of Occupational and Environmental Health. And I am also the director of the Healthier Workforce Center of the Midwest. So today I'm going to talk to you about some of our work that we've done with the Healthier Workforce Center and the NIOSH Total Worker Health Program. And you can see our website there. We have lots of great resources. Feel free to reach out if you have any questions. Wish I could be there in person, but we'll make do. This is the new normal. So the Healthier Workforce Center of the Midwest is funded by NIOSH. We are one of the 6 funded Total Worker Health Centers of Excellence. We've been funded since the original round of funding. And our mission is to protect and preserve worker safety and health through knowledge generation or research and dissemination of evidence-based total worker health practices. And we're founded at the University of Iowa, but we're actually a partnership with Washington University in St. Louis and the Nebraska Safety Council. So we really try to serve Federal Region 7, and you can see that by the states in the bottom right-hand corner. There are 6 centers of excellence for total worker health. You can see those are the states indicated in red here, and the blue states are what are called NIOSH Total Worker Health affiliates. So they're not receiving funding from NIOSH, but they are states where there are organizations who are practicing or promoting total worker health, and so they can apply to NIOSH to become an affiliate status. So today I want to talk about how total worker health is an expanded definition of occupational safety and health. I want to discuss the impact of job-related factors on employee health and productivity and identify approaches to mitigate these hazards. And I'm going to give 2 examples from research that's been done at our center. So we know that work impacts worker health and well-being both positively and negatively. Beyond the physical demands of work, there's other job-related factors that also impact health. Things like long work hours, wages, the organization of work and the pace of work, so those job demands and controls. Things like interactions with coworkers, access to leave, paid sick leave, job stress, and job security are all factors that impact our health and well-being. The other thing is work also impacts where we live and how we commute. Some of us may have a longer commute time, or these days, some of us may not have much of a commute time, maybe just downstairs to the basement. Work can also take time away from other pursuits, things that impact our health as well. So our ability to sleep, to get exercise, make food and diet, and relationships. So work and health are definitely interrelated. So if we think about the influence of work on health, there's been a lot of research looking at shift workers, and we know that shift work is associated with elevated risk for cancer, diabetes, stroke severity, heart disease, and even the risk of violence. So lots of research showing the influence of shift work on health. Work also influences some of our behavioral choices. So it impacts things like tobacco use, physical activity, and other health behaviors. So the example I like to give is if you're feeling really stressed at work, maybe, I teach and I do research, I'm having a really busy week. I may be really tired and come home and not want to cook dinner or not want to exercise. I just want to lie on the couch and eat potato chips. So you can see that there's that impact of work on my behavioral choices there. We also know that work can impact our relaxation time. And this is kind of an interesting study that came out that found that the average American worker takes less vacation time than a medieval peasant. So it's interesting because, a peasant's life wasn't pretty good. They had to work really hard. It was a very demanding job. And diet might have been poor, hygiene might have been poor, but in spite of this, they did get a lot of time off because there were periods of the year where there was no work to be done. So they would have kind of those forced vacation there. So we look at our life today now, and it's kind of interesting to make that comparison. So traditionally, occupational safety and health has focused on preventing workplace injuries and illnesses. And a lot of research has looked at the cost of those workplace injuries. If you look at the circle on the right, you can look at who's paying for these workplace injuries here. And many people think that if they're injured on the job that, oh, it's all going to be covered by workers' compensation. And in reality, that covers only about 20% of the total cost. Other costs are picked up by state, local, and federal government. Private health insurance also plays a role, but more than half the costs come from the individual's out-of-pocket expenses. So the financial burden on the workers is high. There's also a burden on the employers as well. But workplace injuries also are associated with indirect costs. So when somebody becomes injured on the job, there's going to be a loss in productivity. The worker may be absent for a period of time. The plant may be closed down if there needs to be an investigation, if OSHA needs to get involved. There's administrative time in processing the paperwork and follow-up. Insurance can increase. That can have a big impact. And the morale can be low. Imagine if your coworker who works next to you every day is injured. You're going to be worried about, could that happen to you? You're going to be thinking about what's the implications. And for some companies, it actually may impact their reputation or be in the news and the media, and that could have adverse impacts. But one of the biggest impact is the families of the workers that's been injured, that they may be dealing with excuse me, an individual who's become disabled, but there's also research that shows over time a worker who's been injured earns less money than a worker who has not been injured. So these workplace injuries and illnesses have a definite cost to the employers and also to the families. But if we switch gears a little bit, we can also look at risk factors and health conditions and see a little bit what the costs are. And this is information that comes from the Society of Human Resources and Management. And what they're looking at in the green table here is risk factors and the percentage of workers that engage in these risk factors or have these health conditions. And it ranges from low intakes of fruit and vegetables, physical inactivity, high cholesterol, high blood pressure, smoking, asthma, diabetes, alcohol abuse. And you can see that one of the risk factors that most workers, more than 3/4 of all workers, engage in is low intake of fruits and vegetables. Fewer workers, 5% engage in alcohol abuse, and cigarette smoking is about 20%. So those are the workers that are engaging in these behaviors. And we know that these behaviors can lead to chronic conditions, but they also have an impact on medical expenses. And that's what this graph is showing here. For each of the risk factors listed in the table on the left, except for fruit and vegetable consumption because there's not enough data, we can see what is the approximate annual medical cost for people who are in a high-risk category compared to those in a low-risk category. So this is the difference between high and low-risk individuals. And you can see that these are pretty significant costs that can add up over time. For example, physical inactivity is $982 additional dollars for somebody who's physically inactive compared to someone who's not. So this is real dollars and cents. And for an employer, when you're looking at high cost of medical care, we're concerned about trying to keep those costs down, trying to make it affordable to provide insurance. These health behaviors or risk conditions also have an impact on productivity. So those same categories there have an impact on absenteeism, whether or not people show up to work or if they stay home, but also on presenteeism. And presenteeism is when people come to work, but they're not very active or productive at the job. So you can see that each of those risk factors have an associated impact on absenteeism and presenteeism. And this actually will cost the employer money and make it difficult for them to conduct businesses. And if we look at employers' health-related costs, we see that medical expenses, which is in the upper right-hand corner, account for about 1/4 of all expenses. Workers' compensation is about 1%, but by and far, the largest category is called presenteeism, and that is accounting for 58% of all the health-related costs associated with employers. So when we combine all of this information and all of this research that's been done, this is why the total worker health approach developed. So NIOSH launched the Total Worker Health Program in 2011 to address these challenges, and they wanted to focus on promoting a broad, holistic approach to worker health and safety. Total Worker Health focuses on programs, policies, and practices that improve the nature of work itself, help to maintain a commitment to improving working conditions, and that can have the biggest impact on safety and health. So the first thing with Total Worker Health is that box on the left, and that is we need to first keep the workers safe. We need to look at how work is designed and how it's carried out in order to make sure those protections are in place. Then we want to add different policies, programs, and practices, interventions that can think about those challenges workers are faced and start to address those. Those are the things like we talked about, those health risk behaviors and other factors there. And the goal of this program is to improve worker well-being. So we've expanded the traditional safety and health perspective in occupational research to include this broader perspective of health, safety, and worker well-being. So the goal of Total Worker Health is to, first of all, protect the health and safety of workers, but then it's also to think about things like increasing retention. Rehiring employees is expensive. There's a big cost associated with that. So once they're in a job and trained for a job, keeping them in there, making sure that they come to work, that they're not missing work days due to things like an injury or depression or stress or burdens of taking care of other family members. Productivity is very important. Companies need to be productive in order to stay in business. Containing costs, we have rising healthcare costs, and ultimately the goal of Total Worker Health is to improve worker well-being. So hazard mapping is a tool that's been used to identify hazards in the workplace. And if I actually was there in person, I might make you guys do a hazard mapping activity because it's kind of fun. But I'm not there, so we'll just kind of use this as an example. So hazard mapping is pretty simple. You ask people to get together and draw a diagram of their workplace. And you can see we have a construction site here, and it's captured here on the drawing there. The next step is you ask people to indicate on their work site what are the hazards that are present in their workplace. And when people think about hazards, we often think about physical hazards, things like noise or radiation, temperature or vibration. There might be biological hazards such as pathogens or mold. There could be chemical hazards, gases, vapors, dust, and fumes. Think about biomechanical hazards, that fast pace, force and posture, repetitive motion. And we can also think about the equipment we're working with, large machinery, slips, trips, and falls, working from heights. So there's a whole range of hazards that we're dealing with. And I added in this picture of a nurse here because we know that our healthcare workers right now are faced with a lot of hazards that are new to the workplace. And this is impacting how we're all doing business with COVID-19. So these are the hazards that most people think about when they draw their hazard map there. And that's probably what we most think about. But we then ask our people who are doing the hazard mapping activity to step back and think about other hazards that might be impacting workplace safety and health. And in this case, this is things like chronic health conditions or the commute time. Maybe it's coworkers or supervisors that are not supportive. Harassment or violence in the workplace, forced overtime, insufficient training, monotony. We can also think about the work-life balance here. And the sandwich generation is referring to people who have the burden of taking care of kids, young children at home, but also the added burden of taking care of parents who may need additional medical care or support or assistance. So people who are caught in the middle, both by the younger and older generations. And as much as I like to think that when I go to work, I leave my home life at home, I realize that it does tend to merge together. You maybe need to make phone calls, you need to field appointments with people, you may have calls from your children. And this day and age, if many of us are working at home, our work and home is now one and the same. And we're going to see that that's going to have an impact on stress. A new hazard that we're seeing is also prescription pain medicine. There's been lots of research looking at opioids. Opioids are relevant to the workplace because oftentimes that is where people first become introduced to opioids, is that they may experience a workplace injury and then be prescribed, and that may be the pathway for them. So again, we move from these traditional hazards to an expanded definition of hazards, and we try to put those all onto the map where we can then start to think about what to do next. So we need to prioritize. How are we going to control these hazards? And we use the NIOSH hierarchy of controls, which is used traditionally in occupational safety and health, where things at the top of the hierarchy, elimination and substitution, are more effective measures of controlling. And these are changes that are made to the workplace. We're trying to change the workplace so to eliminate the hazard or substitute a safer alternative. As you go lower through the hierarchy, we also can change the workplace by trying to use engineering controls to isolate people from the hazards. So we may build in a machine guarding, which keeps pinch points and cut points covered. We may have protection or barriers between hazards and exposures, things that we again are doing to the workplace. And these top three don't rely on individual behaviors, and that's why they're considered more effective. At the bottom of the hierarchy, we have other methods of controls, but they tend to be considered less effective because they rely on individual behaviors. So for example, administrative controls is trying to change the way people work by having policies in place about what you should and shouldn't do in the workplace. It may also focus on training or hygiene issues, different ways, but they rely again on the individual engaging in those. And at the very bottom of the hierarchy is personal protective equipment. And these are great and should be used, but again, it relies on the individual using them appropriately and having them available in the workplace, and that they're properly maintained and cared for. So if we can think about solutions, we want to change the workplace to eliminate the hazard versus handing out personal protective equipment. I put a link here to a video that we developed that explains how this can be applied to total worker health. And NIOSH has also modified their hierarchy of controls to expand to address this new definition of occupational safety and health. So again, you want to eliminate working conditions or hazards that threaten safety, health, and well-being. You want to put in policies, programs, and practices that are promoting health and well-being, redesigning or engineering the workplace for thinking about safety, health, and well-being, and then using education or administrative controls, and there's encouraging personal change. And when you think about it, we have a worker we're trying to protect in the workplace. So we have an individual. And when we look at wellness programs, those are focused on changing individual behaviors among that worker. So you might have offer a smoking cessation program, or you might talk about programs to increase physical activity or to engage in safe behaviors there. But we want to move beyond individual behaviors here to think about the workplace and policies at the local level, the state level, and the national level. So when we think about total worker health, we're thinking not just about the individual. We want to focus on these other levels, a more broader approach. Another factor we need to consider is the rapidly changing nature of work. The workplace has changed. We've seen an increase in gig workers, Uber drivers, temporary workers, people who are working in multiple jobs. A lot of times we have college graduates who go off and they have difficulty finding a job, so they're underemployed. They may not know what their career advancement is. What are the possibilities? Job security isn't there. Health insurance is a big risk because it's very expensive and companies cannot afford to offer it. And what is offered with that? We have a more diverse workforce. We have younger workers and we have older workers and we have people from different backgrounds working together. We want to make sure that people have a voice in the workplace. And then we're moving more and more towards automation, artificial intelligence, robotics, exoskeletons. All of those factors are now creating a new interface between workers and automation. And we need to think about what does that do for health and safety, and what does that do for a worker's concern about their job. And as we've realizing more and more these days, our work has become more global. We have ties through countries throughout the world. And these are skills, or these are factors that we need to think about when we think about what is going to be up and coming for safety and health. And certainly one risk factor that we're really seeing here, one changing nature in the last couple of weeks, has been COVID-19. Part of the reason I'm doing this seminar from Iowa and not Michigan is because of COVID-19. And it's changed how our students are being taught. It's changed how people do their jobs. We're seeing more loneliness, more self-isolation. I did a webinar earlier this week and we asked about that. Loneliness was the biggest factor that people said what working at home is like. They also mentioned things like access to the refrigerator, lack of physical activity. So again, it's starting to change our lifetime and it's going to have an impact on our health. So the focus of total worker health really is to think about organizational solutions and not individual solutions. So you don't just want to walk in and tell workers to do a job safely. You want to think about what is going on in the workplace. Is there a way to redesign the workplace to build in safety automatically? Go back to our hierarchy of controls. So adding in ventilation, changing the workspace design, doing regular maintenance on the equipment. And I'll give you an example of this in a little bit. The other thing, just like we wouldn't tell workers, is, hey, you need to do a job safely. Don't fall off the ladder. Don't lose your hearing. Don't go by that noisy thing. We want to think about that with other behaviors too. So we don't want to just encourage healthy eating. We want to look at what it is about the workplace that limits healthy eating. So for example, if you worked in a large manufacturing plant and you only have a 30-minute lunch break, are you going to be able to make it from one end of the plant to another, take time to stop in the restroom, get your lunch from the refrigerator, wait in line to use the microwave to heat it up, and have time to make it then back there? And maybe you need to call the school, or maybe you need to call the doctor's office, or maybe you want just a mental break and want to look at Facebook. So there may not be time to eat. Is there a way you can change that? Simple solutions, adding in extra microwaves, making a workplace that is a kitchen that's clean, where the microwave's not grody, or the refrigerator isn't where you don't want to put your lunch. Think about what are the options you have during meetings. What's the culture there? And do people have a place to wash their hands? So again, think about not telling people, hey, you need to eat more fruits and vegetables, and here's a bunch of recipes you can do, although those are good things, but also think about what it is about the work environment. So one example of this came to me when I was doing a talk in Missouri, and a woman approached me that they were working with their city to promote healthy eating and nutrition and in the workplace there, and that they were having a lot of luck with the people that were working in the office, but they were having difficulty with the waste management workers, that these people don't come into the office and they couldn't reach them, and then their solutions didn't seem to make sense. And when you think about it, it kind of makes sense. So what she ended up doing was she went out and she talked to the garbage workers and she asked them, what's going on? And it turns out that the reason that many of them were stopping at the 7-Eleven or the convenience store for lunch was because it was the only place they could get their trucks under the canopy where they could park. So this limits their food options there. And if you think about it, when you think about the work environment, you might not want to store your lunch on the garbage truck. You probably want to have a place to stop and wash your hands and maybe use the restroom before you eat. And so that limits what your options are there. You can say that the same thing is true with long-haul truck drivers, is that those 18-wheelers can't just pull into, the shopping center and go into a grocery store or into a restaurant. Plus, they have time constraints on their job. So think about how we can change the work design. So one of my colleagues, Nate Petke, and his student, Mark Schall, looked at using simulation to evaluate the work design. So 17 million adults, or about 7% of the entire population, report having difficulty performing routine activities of daily living due to a musculoskeletal condition. And if we look just at back pain alone, in 2008, it led to 385 million lost workdays. So in any given year, about 15% of the population will visit a physician because of back pain, and this is in the US. And these musculoskeletal conditions have both direct and indirect costs on an employer's bottom line. Presenteeism, absenteeism, restricted work duties. So what Nate and Mark wanted to do was to look at what are some of the jobs that people in a manufacturing plant are doing, and can we look at changing the work design? So they used the Santos simulation in order to simulate the work environment and make adjustments. Pretty cool, huh? So one example is that the workers would have to drill into these pieces of metal shown in the left picture there, and that the way the workstation was set up, which was a flat tabletop, this caused them to be engaged in an awkward posture where their elbow was up and that they were applying force in an up and down manner, and this can lead to injuries. So what they did is they looked at revising or modifying the workstation so that there was an alternative format there, and the drilling position can be adjustable, which you can see in the picture on the left, which then reduces the force and the strain on the body and will ultimately reduce injuries. So they did this with a number of different work environments, but what's really cool about this is that they were able to look at different characteristics of the workers. So they evaluated the effect of body mass index on the work task design criteria. So they created an avatar that has a healthy BMI. And, this was developed by looking at profiles of 100 individuals with a healthy BMI and putting in these risk factors there. And then they created an avatar who is a little bit overweight. And again, this is based on 100 individuals who are overweight. So they can use these two avatars and model the working conditions there to try to look at the impact in a healthy worker, a worker with a healthy BMI, and a worker with an overweight BMI. So some of the tasks that they looked at was pushing a cart, lifting a window, painting, and lifting a door. And you can see, these are very physically demanding tasks, but they were common in the manufacturing plant. And then they evaluated the work design, and they compared the healthy avatar with the overweight avatar. And they found that for certain tasks that the current design exceeded the right shoulder torque capability for 65% of those in the overweight BMI category for lifting the window, and 10% for the healthy BMI population. And a little bit is seen with the lifting a door. So this gives them guidance on, hey, where do we change the work environment? Because an employer doesn't have a whole lot of money to change everything around, but where can we really have an impact here when we think about worker characteristics on health and safety? So evaluating the work design is really important, and making changes to the work environment is also important. So switching gears, let's think about risks that are relevant to worker safety and health in different occupations. And this is an iconic picture that is often used when we talk about construction work here. And you've got, workers back in the early 1900s on a beam here. But the arrows are pointing out that even back then, those workers are engaging in unhealthy behaviors, that you've got people who are smoking, they're certainly engaged in a high-risk thing. And one of them is actually holding a bottle, which the one on the right, which doesn't look like a water bottle. It looks like it might contain an adult beverage there. So these health behaviors have been around for a long time. And if we look at fatality rates in different industries here, and here we're comparing agriculture, which is the dark blue line, mining, which is the light blue line, construction, which is the red line, with manufacturing. And the overall fatality rate for all industries is 3.4 per 100,000 full-time employees. And you can see that certainly agriculture and mining exceed that level, but also construction does. And so we decided to look at a project with this construction industry. Other facts when you look at construction workers compared to other workers is we see a greater incidence of chronic conditions such as hypertension and heart conditions. So these are the percentage of workers at different age ranges in the construction industry in red and in all industries in blue. And we can see that construction workers have a higher risk for these chronic health conditions. We can also look at overweight and obesity by age group, comparing construction industries in red with all industries. We can look at smoking rates, and we see construction workers have a higher smoking rate than workers in other industries. The good news when you look at this graph is you see that in general there has been a decline in smoking rates over time, but it's still high. And then there's some factors that are unique in the construction industry. So safety in the construction industry is complicated due to the rapidly changing work environments. There's unique hazards in the industry, and oftentimes there's organizational issues when you have to coordinate between different contractors on a single work site. We also know that there's a large number of small construction contractors in the United States. And we know that small employers in general have fewer access to resources and don't often have a dedicated health and safety person who's working on the site. And we know in these smaller companies that these workers are killed on the job more often than those in larger industries. But other factors that are unique to the construction industry is that they may spend long periods of time unemployed. So construction can be seasonal in nature, and this is what the graph on the right is showing us. And you can't work during the winter time. So you see this sawtooth pattern here in the red figure on the right, which is showing that they struggle through periods of unemployment during the winter times there. And you know, in 2009 through 2011 and 12, we had that the last recession, which many of the construction workers were unemployed. Be curious to see what's going to be coming up in the next couple of years. We also know that when construction workers are injured on the job, that they spend more time away from work than workers in other industries. This could be because of the severity of the injuries, but it could also be due to the fact that they need to be capable to do the more physically demanding work. Lots of factors there. So the construction is a unique industry there. And what we were interested in was looking at the impact of these different work factors on specific health behaviors, health outcomes, but also workplace effects such as productivity, absenteeism, the cost to insurance, injury risks, and also prescription pain medicine. So we conducted a survey in St. Louis working with apprentices that were part of the Carpenter's Joint Apprentice Program and the floor layers. And we asked them questions about the work environment, the safety culture, health behaviors, and health outcomes. So things like job stability, whether or not mandatory overtime is in place, their commute time, do they have formal breaks, what are the facility like? Is the work physically demanding? We also asked about the culture, so supervisor and coworker support, your relationships, health behaviors, sleep, physical inactivity, tobacco use, alcohol consumption, and then pain, musculoskeletal pain, distress, and any injuries or disabilities. And in our first manuscript, we looked at what is the impact of these factors on workplace outcomes, such as productivity, missed work, or the use of prescription pain medicine. And what we found is that we had over 950 apprentices complete the survey, which is a 90% response rate. The mean age of the apprentices was 28. Sometimes when I say apprentice or a trainee, people think younger ages, but the mean age was 28. They ranged from 18 to 59. They'd been working in the trade for a little less than 3 years. About half of them were employed in residential construction, and the majority were white. We had a few female participants, but because their numbers were so low, we excluded those, and we also did not include workers who were not currently employed. We didn't know why they weren't currently unemployed, but we didn't want to include them in our analysis. So overall, 95% report good general health. They had no conditions hindering their work. About 38% reported they were current smokers, and the national average is about 17%, so that's pretty high. We asked about alcohol consumption and specifically binge drinking, and binge drinking is five or more drinks within a setting, and how many days they did that within a month. So 32% report binge drinking 5 or more days during a month, which is again very high. Sleep was about normal, a little low, about a little over 6.5 hours. Almost a quarter report pain during normal activities. Diet was about average. We had a series of questions asking about fruit and vegetable consumption, fried foods, and they were right in the middle there. And physical activity again was in the middle, a little bit higher little higher with physical activity there. So some things are concerning, other things seem to be in the range there. Looking at the workplace characteristics, we asked about commute to work, so 42 miles one way. Most of them had no limits on the hours they could work during a day. So that means that if they're running behind or they're trying to get the work done quicker, that could be something that is encouraged. A little more than half had smoking restrictions on the work site, so that means you can't work on the site. Doesn't mean you can't walk off site and smoke. Very few provided sunscreen. These often are outdoor jobs. About a third had no mandatory break time. So remember, these are physically demanding tasks, and there's not a requirement to take a break. And although only 8% reported mandatory overtime, the feedback we got from the apprentices was that even though it's not required, the employers still expected overtime. And that's probably due to deadlines and not meeting the, trying to get the job done in a timely manner. So what we found is that there was association between these factors looking at work organizations and these outcomes. And we found that the more demanding the job was, physically demanding, whether or not you had supervisor support or job security, if you were worried about your job or had long periods of unemployment, those factors were associated with things like low workability. So that's a measure similar to presenteeism. You would report impaired productivity on the job due to health conditions. You were more likely to miss days of work due to injury or illness, and you're also more likely to use prescription pain medicine. And that's a concern when we think about opioids, and we've got an additional follow-on study that Anne-Marie Dale is leading, looking at prescription prescribing methods among these apprentices there. We also found that other factors such as mandatory overtime, low coworker support, and the foreman's view of safety, whether it was high or low, also impacted these outcomes. So this gives us something to go back to the employer and talk to them about the outcomes that really directly impact their bottom line and they're very interested in, and help them to think about solutions or interventions that they can do to impact these factors that are driving those outcomes. And that's the next phase of the project. We also looked at the difference between residential versus commercial construction workers. And we found that the residential construction workers reported more job demands and job strain. They missed more days of work due to injuries. They had more pain, and then they had a higher use of pain medication. So thinking about construction workers, we need to maybe think more about the different types of construction workers that there are, and that those residential workers who may have fewer resources might be more vulnerable. So overall, what we found from our survey is that our apprentices report high levels of job satisfaction, job security, and social support, but they also report high rates of musculoskeletal symptoms. And there are work organizational factors that are impacting health outcomes and behaviors. And we have other publications coming out, which I didn't go into here. So this demonstrates how work organization and the work environment influences business outcomes among construction workers. And we can make the case to employers to think about interventions and to introduce them into the workplace. So in conclusion, I want to say, the work environment matters. It's probably the most important thing. Workplace policies matter. I didn't go into a lot of details about that here, but having policies about mandatory overtime or formal breaks or even smoking policies can also impact health and safety. When you think about interventions for occupational safety and health, you want to think about not focusing on the individual level, but focusing on the work environment. We want to go beyond the individual level and have that broader approach to occupational safety and health. And you need to start integrating your thinking and practice around safety and health to include both those traditional and those non-traditional hazards that are available. So last thing I'll just mention here is that we have different resources on our website. Check us out. Some of you might recognize our dean, Edith Parker. I think she's got ties to the University of Michigan. She's in a video talking about that. We also have one-page toolbox talks that address these different types of hazards. You are welcome to take those and adapt those. And then one of our pilot grants was with the St. Louis Business Health Coalition, who developed an employer guide on total worker health. Again, these resources are free and available to anyone. We'd love to have them used. Reach out if you have any questions. We've also put together an employer resource guide to address COVID-19, since that is an emerging issue we're all dealing with at the moment. And if you have any questions, I'll be available Friday during the seminar time. We can have a good discussion, or email me. And also, please reach out to our website. So I thank you for taking the time to listen to me all the way to the end. Should have put a prize here. Oh, that would have been good. Anyways, I look forward to talking with you on Friday. Thank you very much.
Great. Thank you so much. I'm going to stop the recording.